So welcome everybody. This is the second lecture with Olixn Adams. The topic today is part two of his lecture series on the immune system. And the topic today is food as medicine, your inner pharmacy. Dr. Adams is a board certified practitioner of family medicine and practices holistic medicine at Southern Coos Hospital in Bandon, Oregon. He uses traditional osteopathic medicine when caring for his patients in the clinic, hospital, and emergency room. He is a faculty member of the Biodynamics of Osteopathy program and lectures internationally, teaching osteopathic medicine to physicians from around the world. Dr. Adams synthesizes the principles of Ayurvedic medicine and osteopathic medicine to provide a deeper understanding of physiology, spirituality, and the wholeness of life as it pertains to health, healing, and well-being. So welcome, Dr. Adams. Thank you so much for being with us and sharing your knowledge today. I'll hand it off to you.
Thank you, Rosa. Good morning, everybody. Let's take a moment of silence and acknowledge the gurus and teachers of Ayurvedic medicine and the lineage of osteopathic medicine. These gurus, masters who have worked tirelessly to bring forth this beautiful wisdom, this beautiful science for the benefit of all mankind. It's a tremendous opportunity and a tremendous blessing to have the opportunity to study together, to discuss these beautiful teachings. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Para Brahma, Tashma Shri Gurave Namaha, Tashma Shri Gurave Namaha. I humbly bow to the omniscient Guru within each of us. I humbly bow to the divinity within all of you. All of life is created from one substance. There's only one substance. You could think of it as a vast ocean, which we're all in. In the ultimate reality, this ocean is inside of you because our consciousness is so expansive, it encompasses this entire ocean. But from the point of view of this limited body, we're inside of this ocean. Gurudev, Baba Hariharananda, used to call it an ocean of divine bliss. The deeper you go through meditation, contemplation, prayer, and grace, the deeper you go into the ocean. And at the bottom of the ocean,
What happened?
30,000 auctions.
you see one substance.
Keep it going. Think about her. Yeah.
Are we connected?
We are. I apologize. I've gone ahead and muted everybody now.
Everybody can hear okay? Okay. What happened? I heard somebody say. I don't know. I guess we went to the bottom of the ocean. It's one substance, this ocean. On the surface of the ocean, we find diversity. We find movement, we find waves, we find storms. But from the point of view of the bottom of the ocean, it's one substance. Now, interestingly, the Ayurvedic physicians and also the osteopathic physicians have recognized two substances within the body that most reflect this substance in its pure and undiversified form. This one substance in its undifferentiated state. In Ayurvedic medicine, they call this substance rasa dhatu, the plasma. And in osteopathic medicine, we also recognize a substance called the cerebral spinal fluid. Dr. Still, the founder of osteopathy, said the cerebral spinal fluid was the highest known substance. It can receive the imprint of the imago Dei, the perfect form. So when we attune our mind and our thoughts to the divine vibrations, divine light, divine sound, divine vibration, the imprint of those frequencies imprints on the cerebral spinal fluid. It receives the divine image. It transmits that image and that information to every cell in the body through a process called neurotrophic flow. It's a scientific term for the movement of the cerebral spinal fluid out of the third ventricle, the cave of Brahman, through the nerves, through the pranic channels, to every cell in the body. So we have this perfect substance in the cerebral spinal fluid and in the plasma. It's waiting to receive information. It's waiting to receive the divine imprint. It imprints in the cerebral spinal fluid, and then it's disseminated through the entire organism as the perfect form, the perfect information to every cell. That is the perfect immune system. The immune system doesn't get any better because it's receiving perfection all the time. We discussed at the last meeting the third ventricle as the seat of the immune system, the fulcrum for the immune system, the cave of Brahman. And inside the third ventricle is the largest concentration of cerebral spinal fluid in the body. So we have this perfect substance resting inside the cave of Brahman, waiting to receive the imprint of the divine, and then communicating that throughout the entire organism. It also receives information from every cell through the plasma, through the nerves, into the lateral walls of the ventricle. Is something called the thalamic nuclei. It's receiving a tremendous amount of information from every cell, every tissue in the body. So we have this meeting place inside the cave of Brahman, where the higher vibrations are meeting the incarnate form in creating something we call life, the substance of life. So we're all in this ocean of plasma, of cerebral spinal fluid. It's both inside and outside of the body, passing through the body, and we're all resting in it all the time. Inside the cave of Brahman, inside of the third ventricle, there's another substance. There's a fire. It's a special kind of fire. Gurudev liked to call it Brahma Agni, divine fire. And this divine fire, Brahma Agni, gives rise to another fire. That other fire is called Vishwanara. Vishva means universe, and Nara means man. So it's a universal cosmic fire, which means this fire is in everyone. So now we have two fires. There's a fire in this third ventricle, a divine fire, uncreated light. It's soul consciousness. It can never be diminished. It's always there. And it gives rise to an incarnate fire. Brahma Agni is pre-incarnate, uncreated light. Vishra Agni is created light. It's the digestive fire. It's your personal fire, which is up to you to care for. We need to have the proper care of this fire because it's our digestive fire, which gives rise to proper digestion and assimilation. It also gives rise to comprehension, understanding, and memory. These are all processes of the fire, of Agni and digestion. So in the context of the immune system, there's a profound connection between the cave of Brahman and the digestive system. We need to care for this fire that's in the digestive system. How do we care for it? We need to somehow have a communication with the fire, an understanding of the fire, a deeper understanding. Natural healing is about understanding the natural laws of the universe and communicating with those natural laws. So, how do we communicate with sunshine? How do we communicate with fire, earth, air, water, and ether, and the 5 basic elements? Well, one way is by listening. If you really want to understand something at its deepest level, we need to listen. We need to listen. Listening is connected to the ether element. Each of the 5 senses is connected to a particular element. So listening is connected to ether. Touch is connected to air. Sight is connected to fire. Taste is connected to water. And smell is connected to earth. Earth being the densest of the elements. The first thing you notice when you walk into a room is the smell. So when you taste something, you're actually smelling and tasting because you're involving two senses and two elements. And when you see something, it's actually involving earth, water, and fire. When you listen to something, you're getting all five elements at the same time. So you're actually getting more information by listening than by seeing or looking with the eyes. You can listen to anything. You can listen to water, you can listen to fire, you can listen to your body, you can listen to your environment, you can listen to the sunshine, you can listen to the flowers. And as you listen, you get a deeper understanding of the essence of what's being listened to. And as we go deeper, we begin to transcend the five sense organs, and we begin to listen with our heart, which brings about an even deeper understanding. So we need to listen to our bodies. We need to listen to our digestive system. We need to listen to the food that we're preparing and the food that we're going to eat. In the Bhagavad Gita, in chapter 3, it states that all beings have evolved from food. And it goes on to say, offering of human inhalation is an oblation to that fire. It nourishes the human life force. So all human beings come from food. It's the food that sustains the body. And it's actually the food that creates our state of mind. Because there's actually two types of digestion. There's a gross digestion and a subtle digestion. The gross digestion we're most familiar with. We chew the food, we taste the food, which is a very important step in digestion, is the taste. That taste is actually informing the entire organism. Every cell in the body knows what's coming based on the taste. There's taste receptors on different parts of the tongue. So when you taste bitter, it gives a signal to the liver to begin preparation for digestion. When you taste sweet, it gives a signal to the pancreas to prepare for the digestion. It's interesting, sometimes we have patients in the hospital, maybe with pancreatitis and severe abdominal pain. If they taste the food, it triggers their pain and makes their symptoms worse. But if we put a feeding tube and put the food directly into the stomach and send the food directly to the stomach, bypassing the taste, it often does not set off their pancreatitis or their abdominal pain, which further proves the connection between the taste and the digestive process. So when we begin to eat our food, it's very important to eat it with the consciousness. Really taste the food. Bring your consciousness, bring your awareness to the taste. It's an important step in the digestive process. Gross digestion actually starts before we put any food into our mouths. Gross digestion starts when we go to the grocery store, believe it or not. When we go to the grocery store, we should go with an attitude of gratitude. It's an opportunity. We're picking out our food. We should be spending the money that's earned in a proper way. And we should go with gratitude. I was recently talking to a friend and she was lamenting how she didn't like to go to the grocery store. It was stressful for her. She didn't like it at all. I said, you need to change your attitude. She was having a lot of digestive trouble, lots of abdominal trouble, trouble with assimilation, trouble with bloating, all kinds of trouble. I said, look, you need to adjust your attitude and have an attitude of gratitude. You go to this beautiful grocery store, there's so much beautiful produce and options, so many parts of the world, there's nothing on the shelf. So when we start to shop for the food, we're starting our digestive process already. And you bring the food home and you give gratitude and thanks. Clean it, put it away, and store it for when you need it later in the day to prepare your meal. There's a whole science to the preparation of the food. We'll talk about that at another time. But how the food is prepared also affects the digestion and also affects which tissue most is nourished by the way that it's prepared. For example, if you juice a food and drink it, the juicing process really tends to nourish the endocrine system and the hormonal system. If you stir a food and it goes through a lot of stirring, it tends to activate the fire. It really stimulates the fire within the digestive system. There's all kinds of subtle things in our preparation of the food. So we should pay attention. At the very least, while we're preparing the food, we should be mindful and prayerful and thankful that we have the opportunity to prepare the food and to eat the food, not to be in a hurry while we're preparing the food or eating the food. That all pertains to what we call gross digestion, which is a process of about 6 to 12 hours from the time we put the food in the mouth and chew it, and it passes into the stomach and through the intestines. And there's several phases to this. But what gets really interesting in the digestive process, as it pertains to the immune system, perception, and fire, is the subtle digestion, which takes 35 days. So Rosa, if we could put up the slide on the tissues. We have some slides to show. Here we have some microscopic pictures of the different tissues. There's 7 basic tissues in the body. And in Ayurvedic medicine, they'll call it rasa, rakta, mamsa, meda, ashti. So on the upper left corner, we have the rasa dhatu, the plasma. And inside of the plasma is the red blood cells, which is the rakta dhatu. In Western medicine, they consider that to be one substance. But in Ayurvedic medicine, these are 2 tissues, 2 substances. So in subtle digestion, after it passes from the intestines, it's been liquefied, and this food passes into the plasma, the rasa dhatu, which is in the picture in the upper left corner. And this tissue spends several days digesting and refining the substance. And it creates a refined and unrefined substance. The refined substance gives rise to the top layer of the skin. It also nourishes the breast milk in a pregnant woman. The unrefined substance creates phlegm, which is important also. Then there's a super refined substance that passes on to the rakta dhatu, those red blood cells. And that super refined substance is absorbed by those red blood cells And they spend about 5 days refining and digesting. That refined substance is then passed on to the next tissue, which is the muscle. And the muscle spends about 5 days digesting and refining. The unrefined substance of the muscle becomes earwax and sebaceous type of material. Sometimes we look in the patient's ears and we see really, really thick earwax. It tells us that the digestive process at the level of the muscles is weak. They need some support. It also tells us they may be getting too much dairy or too much of some substance that the muscles are having difficulty digesting and absorbing. So a tremendous amount about the digestive system can be told just by looking inside the ears. From that muscle, after 5 days of digestion, a super refined substance is moved to the fat tissue. The mamsa dhatu, which is a very, very important tissue in the body. It doesn't get enough credit in Western society. Everybody wants as little fat as possible. But fat is essential to the digestive process. It's essential to the immune process. And it's essential to your health and well-being. So the fat spends about 5 days digesting and refining. And a super refined substance comes out and it's moved to the bone. And the bone spends 5 days and it's moved to the bone marrow. And finally, a super refined substance is moved to the nerves and the reproductive tissue. So what you ate 35 days ago is nourishing your bone marrow and your nerves today. And it's informing and telling the nervous system what to do and how to behave. If you eat a lot of dry, stored, processed food, potato chips, crackers, at day 35, the nerves are receiving the input from that subtle digestion. They think something's wrong. The nervous system thinks something's wrong because it shouldn't be just all dry, hard, stale food. The only time you get dry, hard, stale food without fat is when there's a problem in the outer environment. A famine or a war or a massive fire, that would all lead to us eating hard, dry, stale food. But in times of abundance, in times of balance, we're also eating fat and other healthy foods that are nourishing the nervous system. So if you only eat this hard, dry food, potato chips, crackers, the nervous system goes into high alert. On day 30, it starts to think that there's some type of famine, some type of problem on the outside. And it will start to release special neurotransmitters that will change the whole chemistry of the body. And it will put the body into a state of fight or flight. It'll put the body into a state thinking that there's an emergency on the outside, when there's not. It's just responding to the food that it was given and that it digested over a 30-day process. Now, there's something very interesting also in this 30-day digestive process. And it's interesting that the Ayurvedic physicians noticed this, and the osteopathic physicians noticed it thousands of years later. They speak different languages, they come from different parts of the world, but they both came to this realization that there's this important concept, this important principle. In Ayurveda, they call it kala. In osteopathy, we call it a seam. So if you look at those pictures, you'll see a little space between each picture, and that was put there intentionally. And there's even a space between the plasma and the red blood cells, because that's a seam. That's a space between a function. Any place you have two functions inside of the anatomy, inside of the physiology, where two functions come together, there's a seam or a kala or a space. And this seam is very important because the seam is maintaining and creating both functions. So on both sides of the seam is a function, and there's something passing through this seam called the breath of life. The prana is passing through this seam, creating, maintaining, and destroying the function all the time. And ideally, your breath is passing through the seam. Now, the seam can also get into trouble because the seam is an empty space where problems can get deposited. So toxins can get deposited in the seam. Imbalance of dosha can get deposited in the seam. Vata, pitta, or kapha can be deposited in the seam. Stress hormones, all can get deposited in the seam. And then it loses its normal function. When it loses its normal function, it can no longer digest and process and assimilate properly. And our immune system will be compromised, as well as our nutrition. The whole function will be compromised. So what to do about this? Well, the breath is a tremendous tool that can help us. If we remember back to our last lecture, we talked about thoracic respiration, and we talked about a seam at the diaphragm. And we talked about a stop point. So when you breathe in, slow, long, and deep, a nice deep inhalation, there's a natural stop point somewhere. It's often around the diaphragm. And that's a seam. But as we bring some consciousness to the breath and just watch the breath with love, that stop point will start to change because consciousness and prana is flowing into the seam and allowing the seam to transmutate and create a different form and a different function. And so as we breathe in, the breath can start to go lower into the abdomen and into the pelvis, and there's no stop point. We can't force this to happen. It's a natural process. Just by breathing and watching with a normal conscious breath. Now we could ask, where is the seam for the breath? Where is the seam for thoracic respiration? It actually has two seams. Thoracic respiration has two seams. There's a seam between what we call primary respiration and thoracic respiration. So primary respiration is the breath of life. Primary respiration is the flow of prana that never stops. The divine is in a constant exhalation, breathing out prana, flowing through, never stopping. And that's primary respiration. And thoracic respiration is the use of the diaphragm and the lungs and the movement of the air. So there's a seam between these two, but there's another seam in thoracic respiration, and it's in the pause. So if you notice the breath, there's an inhalation, there's a pause, there's an exhalation, and there's another pause. If we pay a little bit more attention to the pause, we're in the seam. And if you're in one seam, you're in all seams. If you're in one kala, you're in all kalas. If you notice the space, the seam in the breath, it's always there. So we can rest in this pause, and our consciousness begins to rest in this pause that's always there. This stillness, this space is always there, even as the air flows in and out and the breath is moving. There's a stillness that the consciousness can rest in. There's a stillness that's holding the entire breath. And entering into that stillness with awareness will bring a transmutation to all of these seams. It will enhance the function of all of the tissues, all of the digestive process, and the entire immune system. So we have this gross digestion and subtle digestion. Gross digestion is 6 to 12 hours. And subtle digestion is 35 days, going through the 7 tissues, each tissue creating a super refined substance that's then passed on to the next tissue. And at the end of the digestive process, a very super refined substance is created called ojas, which is the essence of your immune system. It's also the essence of the cerebral spinal fluid. There is a lot of ojas in the cerebral spinal fluid. So we begin to see this profound connection between the cave of Brahman and the third ventricle, which is the seat of the immune system, and the digestive process over 30 days. The digestive fire in the abdomen and the divine fire in the cave of Brahman. It's all interconnected. The immune system only functions off of wholeness. We can look at it in its parts and in its tissues, but the immune system is perception, and its perception is only wholeness. It doesn't recognize any parts, because it's in this ocean of divine love that is one. We're one substance. There's only one substance passing through everything. As we come to the surface of the ocean, it looks like there's many substances. There's diversity, and it's beautiful, the diversity. But looking from the bottom of the ocean to the surface, we see it's one substance. When we look at the ocean in the natural world, we have all kinds of waves, different shapes of waves. No 2 waves are the same, but they're all one substance. And they're all returning to their substance. They're all returning to their origin. This divine fire that's in the abdomen, the digestive fire, it only wants to return to its source. Back to the third ventricle, back to the cave of Brahman, and back to the ocean. The nature of fire is to rise. It rises up. So it's a natural movement for our consciousness to rise. It's a natural process for the prana to rise into the higher centers, into the cave of Brahman, and into the ocean. Every substance is returning to home. Let's look at a little more detail at this subtle digestive process. We can take a look at the rasa and rakta dhatu. I think it's a picture on the next, yeah. Nope, back to the other one. So the rasa dhatu, the plasma, is such a beautiful substance, and it's essential to life. One of the One of the principles of osteopathic medicine is the rule of the artery is supreme. They say the rule of the artery is supreme. That means good arterial flow, the river of life must be flowing for there to be good health. But also in that implies what's inside of the artery, what's inside of the river of life must be in good health and in good condition. This rasa dhatu is inside of us and outside of us and flowing through us. And as we said, it gives rise to breast milk. It nurtures the breast milk. It nurtures the top layer of the skin. And it also is responsible for delivering the nutrients to every other cell and every other tissue in the body. What's interesting is the plasma, the rasa dhatu, is always ready to receive new information. It receives and registers every single thought and every emotion that you have registers in this plasma. Every single thought. So you can change your entire biochemistry in 7 seconds through your thinking and through your thoughts. It only takes 7 seconds. A strong rasa dhatu, a strong plasma, strong blood, gives rise to love and compassion. When it's in good condition, you naturally will have strength, stamina, love and compassion and understanding. When the rasa dhatu is weak, when the plasma is weak, you'll naturally have anxiety and fear. So it's important to take care of this important substance. The fastest way to improve the quality of your blood is through faith. It's the fastest way, faster than any food you can eat. Faith, prayer, and love nurtures the rasa dhatu and allows that nurturance, that vibration, to be disseminated to every cell in the body. And it can change in 7 seconds. In the Bhagavad Gita, chapter 17, it says, man is made of faith. Whatever faith he has, thus he is. Our faith is what nurtures the rasa dhatu. Now, in terms of food, well, it's good to avoid fried food. Rasa dhatu doesn't like fried food so much because the frying denatures the oil and the tissue doesn't know how to digest it or assimilate it. So now it's just floating around like an oil slick on the water, and it has to get deposited somewhere. It's good to eat warm, well-cooked, well-prepared foods to nurture the rasa dhatu. Dates are very good for the rasa dhatu. You could soak 5 dates in water overnight, and in the morning take the pit out, add a half a cup of warm milk, blend it up really nicely and drink it. This is a nice tonic for the rasa dhatu. Then don't eat or drink anything for about 2 hours. There's some herbs that are very nice for the rasa dhatu. Holy basil, ginger, shatavari, asparagus root, lemongrass. These are all herbs and substances that nourish the rasa dhatu on a material level. But again, it's your thoughts and your faith that are essential. You could eat the perfect diet and have poor thoughts and lack of faith, then you'll have a weak rasa dhatu. You'll have a weak plasma, weak blood. The blood is essential to the health. And it's always waiting to receive an imprint. The imprint comes from the food we eat. The imprint comes from our prayers. The imprint comes from the prana that's passing through everything. So after the rasa dhatu, we have the rakta dhatu. We talked about the red blood cells. They're concave shaped so that they can change their shape more easily and pass through very, very small spaces. They can fold on themselves. They carry oxygen. Through hemoglobin, the red blood cells are carrying the oxygen. Now, oxygen is not prana. Prana and oxygen are two different things, but they're interrelated. They're like cousins. The prana uses the oxygen and the prana distributes the oxygen, but the prana is not the oxygen. The prana moves the red blood cells through and facilitates the movement of these substances into the different tissues. The red blood cells, the rakta dhatu, gives rise to the vessels, to the arteries, veins, capillaries. And this is starting to be proven scientifically through embryology, but the Ayurvedic physicians actually talked about this maybe 6,000 or 7,000 years ago. And our Western science is just starting to catch up to it, just barely on the edge, that they're recognizing, first off, in the embryo, it's all one substance to begin with. And as a differentiation process happens, the first substance is plasma. That's been scientifically validated. The second substance, the second cell line to actually show up is the red blood cell. Just as the Vedic physicians stated 6,000 or 7,000 years ago. So science is having a little bit of difficulty figuring out what's the next cell line in the embryo, probably because it all happens so quickly. But if the Vedic physicians were correct on rasa rakta, I'm confident that the next one was the mamsa. It certainly is the order of the digestive process. So this plasma and these red blood cells are responsible for the integrity of the vessels. When there's a lot of fear molecules, anxiety molecules, catecholamines floating through the blood cell and into the vessels, there's a constrictive process that happens. They constrict and the flow is inhibited. So now the flow of the red blood cells, the flow of the plasma, and the flow of the prana, the flow of the life force is inhibited. When there is love and compassion flowing through the rasa and rakta dhatu, there's dilatation, opening and expansion, and it all flows more easily, including the prana. There's many substances that create this dilatation effect, and people become addicted to these substances because this dilatation of the vessels actually creates a euphoria because the prana can flow more freely. So alcohol will create a dilatation effect initially. The next morning, there's a rebound constriction, and people call it a hangover. Because all the vessels in the head have constricted, the blood flow has been reduced, the tissues have become dry, depleted, and aren't receiving the nutrient substances from the blood and the prana. And they feel horrible. There's many drugs, marijuana, benzodiazepines, they all create an opening, a dilatation effect. that allows the prana and the blood to flow more freely. But we're fortunate that we have meditation, because meditation creates a dilatation effect. It creates an opening that allows the prana to flow more freely. It allows the red blood cells and the plasma to flow more freely. It opens the river of life, so the river can flow through the entire organism, creating health. It's a beautiful process. So there's a very deep connection between the prana, the plasma, and the red blood cells. They're intimately related. And the cerebral spinal fluid. We can take that picture down and just go back to the regular screen. Now, if questions arise during our discussion, you can type them into Rosa at any time. These talks are sponsored by Pranada Wellness Center. And Pranada Wellness Center is a new initiative under Kriya Yoga. Pranada means giver of prana. And so we're having a talk about once a month. And the Pranada Wellness Center is going to be offering its first meditation retreat in early April, where we will put these principles that we discuss into practice. So at the first retreat, it's going to be a wellness meditation retreat where there'll be meditation and Shirodhara treatment and osteopathic treatment, along with some lectures on these principles in health. The Shirodhara treatment is beautiful because the rhythmic movement of the oil over the third eye brings a subtle soothing to the cerebral spinal fluid inside of the cave of Brahman. And it allows the prana to come to rest inside of the third ventricle. We talked about this important connection in the third ventricle and the cave of Brahman and the function. For it to function properly, it needs to rest. Rest is essential to the immune system. It's a food for the immune system. So when the prana is moving, it's called attention. And when the prana is at rest, it's called consciousness. So meditation does allow the prana inside the cave of Brahman to come to rest and become pure consciousness. Shirodhara therapy also helps with this process. It also allows the nutrients from the oils to seep deeply into the skin and into the deeper structures in the brain and the central nervous system. We'll also be providing osteopathic treatments at this meditation healing retreat, which helps to bring the prana to rest. It rebalances the prana through the entire system and allows for the effects we've talked about to occur more deeply. So that will be happening sometime in early April. There'll be an announcement coming out soon, and that's the Pranada project. Giver of prana. What gives prana? Food gives prana. Breath gives prana. Good company gives prana. Guru gives prana. Ultimately, all the prana comes from the true self, Atma. So Rosa, do we have any questions coming in?
We have plenty of questions, so I'm
Oh, well, we better take a few questions.
happy to start sharing them with you. Barbara was Barbara was asking about itchy skin and the implications of, I guess, skin disorders.
Itchy skin. Itchy skin?
Yes.
Yeah. Yeah, that's an important question because the skin tells us a lot about the health of the body, and the skin is important for the health. The skin is involved in detoxification of toxins, ama. The skin also should be breathing. So we need the skin to be free to breathe. The whole organism is breathing and receiving this prana and this oxygen. When we see itchy skin, it's dry usually, but it can also be hot. And the skin is nurtured by the blood. So the rasa, rakta, dhatu, the plasma and the red blood cells, are what nurture and sustain the skin. So usually if we see a disturbance in the skin, such as a rash or itch, we need to look at the blood. We need to look at the quality of the blood, the health of the blood, and see how we can support the blood. Often itchy skin will say that there's a lot of vata in the blood. So the sympathetic nervous system has gotten overactivated. We've been in a state of stress. We've been in a state of fight or flight. Too much stress and distress has now deposited it into the blood. The nerves of the sympathetic nervous system distribute to every cell in the body, and that includes the plasma and the blood. And we talked earlier about the effect of our thoughts and our mind on the blood, the effect of faith on the blood. So any stressful thought imprints into the blood and then is distributed to every cell in the body. If too much stress, it will get deposited into the weaker areas, the areas where the digestive fire is lower, where the immunity is lower, it's more susceptible. So now you have a sympathetic nervous charge into the whole body from stress, into the blood, and now it's going to feed to the skin, really to all the cells in the body, but it's going to express where it's most vulnerable. And that vulnerability can come from genetics, it can come from your dosha, it can come from lifestyle. Many, many things can affect that. So if you're looking at skin problems, look at the blood. Thank you.
Thank you. And our next question seems to be related.
Oh, good.
Sylvia was asking how to treat anemia without drugs.
How to treat anemia. That is a big question. Who asked the question?
Sylvia.
Sylvia. She's a thinker. Anemia can have many causes. So whenever we talk about treatment, we want to look at the cause. And the cause is going to lie in the individual. So there's not a single cause for anemia. But generally speaking, often anemia, there's too much heat in the blood. Often, not always, but often there's too much heat. Now there's different types of anemia, okay? So there's bleed anemia. There's anemia from bleeding. That bleeding can be chronic, low grade. Sometimes people will have a little polyp in their stomach or their intestine, and it's bleeding a little bit and they'll develop anemia. Bleeding can come from iron deficiency. Bleeding can come from B12 deficiency. Bleeding can come, or anemia can come from poor digestive fire in the rasa, rakta, dhatu. So when the digestive fire in the blood and in the plasma and in the red blood cell is low, it can't assimilate the proper nutrients to form the red blood cells in the hemoglobin that carries the oxygen, which leads to a state called anemia, which is a deficiency of the red blood cell and the hemoglobin. There's other types of anemia that are genetic. But at the end of the day, we have to treat the patient as the individual and find what their cause is. But we can definitely start by looking at the blood and nourishing the blood. We talked about the herbs and the foods that were good for the blood, foods that are rich in iron, foods which are cooling to the blood. Herbs such as shatavari, ginger, holy basil. Basil's a little warming, shatavari is more cooling. We want to support the blood and the plasma in the digestive process, and we want to make sure that there's no bleeding, hidden bleeding. In women, sometimes we'll have anemia from heavy menses. The menses is heavier, and the loss of blood is greater than can be restored in the 30 days between menses, the 28 days between menses. In which case, that's often a hot condition, so we have to look at where the heat is in the uterus, in the blood, in the intestines. Somewhere there's too much pitta, too much heat in that type of anemia. Anemia can also come from kapha conditions, where the kapha is actually depositing into the blood and into the plasma, and it's inhibiting the digestive fire. So it's like throwing water on the fire. And the fire now is not strong, it can't absorb. So if we take the breath and notice the seam in the breath, the pause in the breath, and allow our consciousness to enter into that, that will help. So will thoughts of faith and love and prayer. And then looking at the diet that will support the blood and the herbs. Thank you. Anemia is a big topic. It's not an easy topic to answer. It's very, very dependent on the individual.
Next question.
Next question.
Okay. Liv is asking, how long does it take to make ojas in the body?
Yes, ojas. We love ojas, the happy molecule, the molecule of bliss. So realize every cell makes ojas, every tissue makes ojas, and every organ makes ojas. So the ojas that's coming out of the plasma is over the course of about 5 days. And the ojas that's coming out of the red blood cell is about 10 days. And the ojas coming from the muscle is about 15 days. The super refined ojas, the end result, the ojas of ojas, is about 30 days, 30 to 35 days. So what you're eating 30, 35 days ago is adding or feeding or informing the creation of the ojas today. Now, the Ayurvedic physician said that there should be 8 drops of ojas in the heart, and the rest is circulated into different tissues. And if there's too little, we have heart problems. Too much, we have heart problems, arrhythmias, atrial fibrillation, atrial flutter, pauses. So there's a very precise amount in different parts of the body. The cerebrospinal fluid is a form of ojas. It's a super refined substance that comes out of the digestive process of the nervous tissue and then is deposited, secreted into the ventricular system in the brain, and it nourishes the whole brain, the whole central nervous system, and it creates the immunity in the immune process for the brain and the central nervous system. It's then distributed via the prana through a scientific term called neurotrophic flow. That ojas is then distributed to every cell in the body. Ojas, beautiful.
Our next question is from Cheryl. She's asking about caffeine the effects it has on the body. She's nervous, I think, because she drinks coffee. So a lot of people do. She's curious what you think about caffeine.
Every substance in creation is medicine. But we need the right medicine in the right time and the right quantity. And that's would be called wisdom, the right medicine at the right time in the right place. So too much caffeine will create a vata pitta condition. You're getting stimulation to the central nervous system. You're getting stimulation to the adrenal glands, and they're releasing chemicals into the plasma that inform the system to wake up, to become more alert, to become more active, to circulate the prana. And it's in small amounts for many people is fine. In higher quantities, it can create nervousness, anxiety, agitation, overactive mind. The amount is different for each individual. Some people are very, very sensitive to caffeine. Some people can take larger quantities. Generally speaking, a kapha constitution can handle a little more caffeine than a vata or pitta constitution. So you have to listen to your own body, your own wisdom, when you drink the caffeine or any substance. And that starts at the level of the taste, and it comes back to listening to the substance and listening to your body. As soon as you put a substance into your mouth, you can put just the smallest amount, you get the taste. That taste is being distributed via the prana to every cell in the body within seconds. And you'll have a visceral body somatic response to that substance instantly that will inform you of the effects it's going to have on your system. So you could take one little sip of coffee and you'll know how the effect it's going to have. It will only be amplified the more that you drink. That goes for any substance. The herbs, each herb has its own taste, its own potency, its own heat, and that taste informs the entire body, wisdom, and intelligence. It's amazing. So the taste will tell us the whole biochemical effect in the body. The amount of caffeine will have to be individualized, and you have to decide for yourself the effects, if you want that effect or not. It's not wrong or right or good or bad. Do you want that effect on your mind and on your system?
Thank you. Our next question is from Lee, who's asking, isn't it normal for life to constrict and expand again and again? And isn't it good for the vessels to as good for the vessels to constrict as it is to expand?
Yes, yes, definitely. Life is an ebb and flow. There's a movement in, a movement out. There's a breath in, a breath out. There's a constriction and an expansion. The problem arises when we lose that physiological motion. So there's a normal range of motion of constriction and expansion. It's a very, very good point. Very, very beautiful. So yes, the vessels should constrict and expand. We get health trouble when they lose that capacity. So when the arteries get hard because vata has deposited in them, they get hard and dry, they lose their capacity to expand and contract, and we get a condition called hypertension, high blood pressure. When the system is under too much stress and it goes into a constriction, it begins to lose its capacity to expand, and it gets stuck in a constriction. There are conditions, they're rare, of expansion of the vessels. There's a condition called POTS syndrome. I believe that stands for postural orthostatic hypotension. So the person stands up and they almost pass out every time they stand up. because the system is sort of in a dilated state and the heart starts to beat really fast and they get tachycardia, or postural orthostatic tachycardia. So that's a vata condition where too much vata has distributed into the vessels and into the blood, and you're stuck in a state of expansion. So this question is very insightful. There is expansion and contraction to the entirety of life at a certain level. At another level, there's just the flow of consciousness and prana. So it depends on where in the ocean we're looking at it. If we go dive to the bottom of this ocean, to the source, we see a flow that's only an exhalation, the breath of life, moving out and expanding through everything, creating, sustaining, and destroying. But as we move more to the surface of the ocean, where we get diversity and multiplicity, we see an expansion and a contraction, which is essential to normal physiology in the organism. So it's more a question of the capacity and the range of motion that it has. And as we lose that range of motion, we have less health. There's some therapies where they like to get really hot and jump in cold water. I think it's a little shock to the system, but they do it for the expansion and contraction effect of the vessels. And sometimes when we're dealing with a deep bruise or wound, we'll put ice, heat, ice, or ice, heat, because of the expansion, contraction that those bring. Yeah.
Thank you. Our next question is from Asha Yogi, who's asking, what are some things we can do to keep Rasa Dhatu in a healthy state?
Rasa Dhatu, the plasma. So the plasma is, in its natural state, is a neutral substance that's resting and waiting for an imprint. It's waiting to receive an imprint, and that imprint comes from your consciousness. So a prayerful state of faith and love will bring the most nurturance to the Rasa Dhatu. Avoiding heavy, fried, fatty foods will nurture the Rasa Dhatu because it's easier for it to absorb and digest. Avoiding cold foods will nurture the Rasa Dhatu because it's easier to digest and assimilate. Beets are very nurturing to the Rasa Dhatu. Healthy oils and fats such as ghee is nurturing to the Rasa Dhatu. Herbs such as shatavari, holy basil are nurturing to the Rasa Dhatu. And guduchi is very nourishing to the Rasa Dhatu. Guduchi is good for the entire immune system, really, and digestive system, but it's also very good for the blood and the plasma. Most important is normal conscious breath and reducing unnecessary stress, because all of that stress imprints into the Rasa Dhatu and changes the biochemistry in seconds. A stressful thought, a stressful event changes the entire biochemistry in the blood in a matter of seconds. And a thought of love, compassion will change the biochemistry for the better in a matter of seconds.
Thank you. Our next question is from Mary. She's asking how to treat osteoporosis.
Osteoporosis. So osteoporosis is a condition where the bone is absorbing faster than it's being created. And it speaks to an imbalance in life, because in life, it's being created by the breath of life, the prana with a capital P, that's flowing through everything. And the breath of life brings three characteristics. It brings a creative force, a sustaining force, and a destructive force. And these three must be in balance for life to live. So if we, inside the bone, there's two types of cells. There's osteoblasts, which create bone, and osteoclasts, which destroy bone. They need to be in balance because the bones need to remodel and reshape all the time. A bone isn't a bone isn't a bone. The bone is a living, intelligent tissue that's responding to life. And if you pick up a particular sport that requires more stress on the femur and the lumbar spine, you'll develop a different shape of bone over a period of time. If you swim, you'll create a different shape of bone. If you walk, you'll create different shapes of bone. So these osteoblasts and osteoclasts need to be in balance. So you're creating and destroying bone at the same time. Now, we get an imbalance by various means, through the diet, through stress, through our thoughts, through our genetic field. Imbalances arise and the bone begins to not respond to life in the same intelligence. So now we have a condition where the osteoclasts are more active than the osteoblasts. So the breakdown of the bone is faster than the building of the bone. This is generally a vata type of condition. So stress, again, in the blood gets deposited throughout the body. And if it gets deposited into the bone, you're going to be getting a drier, more brittle bone that's less responsive to life. So to treat osteoporosis, we want to address the vata imbalance in the mind, the vata imbalance in the bone and the plasma. We want to bring the right nutrients. Vitamin D3 is very important. Calcium is very important. Magnesium is very important. And the calcium is best to come from the diet if possible. Calcium doesn't absorb so well. It's a difficult molecule to digest. So they're finding when we give calcium supplement, not that much really gets absorbed. A lot of it is unabsorbed, now floating around in the blood, undigested, and it gets laid down as a plaque in the vessel wall because the blood can't assimilate it. So whenever possible, get your calcium through your food and through your diet, not through a supplement. It will lead to more plaque and it doesn't really absorb that well. So to treat osteoporosis, we need to reduce the vata. We need warm, soothing foods and a vata diet and vata nourishing herbs. We need to address the vata in the mind and bring calming, soothing that will then nourish the plasma and deliver the proper nutrients to the bone. So the bone can restore its balance and the osteoclasts and osteoblasts can function in harmony.
Thank you. Our next question is from Esther, and she's they're asking if you have tips for sleep, for better sleep.
Tips for sleep. Well, we could take a nap right now. So insomnia is a medical term for difficulty with sleep. And what's important when we look at insomnia is to recognize when it's occurring. Because again, any problem or any diagnosis is useless if we don't find the root cause. Otherwise, we're just treating the symptoms and the symptom then will show up somewhere else. So if you suppress a rash, it'll show up somewhere else as heartburn or anxiety or distress. If you give a sleep medicine, like a benzodiazepine, and force the person to sleep, the imbalance is only going to express itself somewhere else. So we need to really find the cause. And part of finding the cause is determining when the difficulty of sleep arises. Is it difficulty falling asleep? Is it waking up at a particular hour and not being able to go back to sleep? Because the hour that you're awoken will give a lot of information as to the cause. As we fall asleep inside the cave of Brahman, the cerebral spinal fluid begins to gently rock from side to side, slowly rocking. It's like the hand of the divine has come to the cradle and is rocking the baby to sleep. It slowly starts to rock slower and slower and slower until it comes to a complete rest, and we doze off into a state of mind, which is one of the three states, called sleep. So Shirodhara can be very beneficial for difficulty with insomnia because it's reminding the fluid inside of the cave of Brahman of its normal, natural movements at the time of sleep. Sometimes we find sleep difficulties, if we trace it back, there was a head injury or a concussion some years back, and it's inhibited the normal motion of this cerebral spinal fluid, and we'll treat that with an osteopathic treatment. Insomnia can come from too much heat, too much pitta. It can come from too much vata, and that can partly be determined by when the person is waking up. Some supplements that sometimes help with sleep, chamomile is very nice. It's soothing to the nervous system. Tagar is very nice. It's soothing to the nervous system. Valerian root is soothing to the nervous system in small quantities in the evening. There's a supplement called GABA, G-A-B-A. It's a neurotransmitter. It's already in the brain. And you take a little bit and it will bring a little bit more GABA to your central nervous system. And GABA is an inhibitory neurotransmitter. There's melatonin, but I don't like to give so much supplements because we're not finding the root cause. Melatonin is naturally released from the pineal gland when there's less light on the retina. It's a substance, a sacred substance that comes out of the back of the cave of Brahman when the light goes dim and is secreted into the body, and the cells recognize it as a communication from the cave of Brahman that it's time to rest, and everything goes to rest. So if you meditate, normal conscious breath, and allowing the breath to reset and drop down lower into the abdomen, as we discussed earlier, will begin to normalize the motion in the cave of Brahman and reset the central nervous system. If you meditate and come to rest gently inside the third ventricle, inside the cave of Brahman, you can reset the normal motion of the fluids and the fire and the normal physiological functions inside the cave of Brahman, inside the third ventricle. And this can help a person come to rest. Some people get woken up at 3 o'clock every morning. This is the hour of the saints. It's not always a pathologic insomnia. Sometimes it's a call from the divine to get up and pray and meditate. That's why I always ask the patient, what time are they waking up? 1 or 2 o'clock would suggest a pitta imbalance in the morning. 3 o'clock, so many people get woken up at 3 o'clock because they are secretly yogis, they don't know it, or saints and sages are coming to pray with them and to meditate with them. So if you're getting woken up at 3 o'clock, it's beautiful. It can be a gift. As long as you're not getting too tired in the morning, you can get up, say a little prayer, a little meditation. Maybe half an hour, 1 hour later, you'll be back asleep and then wake up at 5 or your normal wake up time. So the hour of the insomnia is very important. Lots of ways to treat, but we have to always find the root cause. Thank you for the question.
We have more questions. I know we're just a few minutes
I'll take a
before.
couple more.
Okay, I'm going to skip over. If you've already asked a question, I might skip over that just so that we can get as many people responses as possible. Isabella is asking, what might someone do to support Mamsa Dhatu if they find they have excess earwax?
Excess earwax. You know, Dr. Still, the founder of osteopathy, wrote a whole chapter on earwax, if you can imagine, a whole chapter. He found it so important. And he paid a lot of attention to the children that had too much earwax. He was very concerned for their immune system, and he would treat them and pay very close attention to them. And so these waxy substances are part of the byproduct of the digestive process of subtle digestion of the muscle tissue. So each tissue, as it digests, creates a superior and an inferior substance. And the superior substance goes on to the next tissue to create more, eventually ojas. The inferior substance of the Mamsa Dhatu, the muscle, is these waxy substances such as earwax. So we want to support the muscle tissue to have better function, better digestion. So we want to make sure that the muscles are getting proper exercise and proper movement. Stretching and yoga, yoga asana, very beautiful. Walking, and depending on your constitution, maybe a little bit of cardiovascular exercise, especially if you have pitta constitution. So we want to oxygenate the muscles. We want to get the prana into the muscles so that the digestive system can improve. Ashwagandha is a very nice herb to support the muscles. We just have to be cautious with ashwagandha if there's too much ama or toxicity in the muscle or system. We want to detoxify before too much ashwagandha, because ashwagandha builds muscle. It's a metabolic substance that's going to create more of that substance. Dairy, lots of dairy, too much dairy will slow down the digestive process, especially cheese. So caution with too much cheese if you think that you're having digestive weakness in the muscle. Ginger tea, fresh ginger tea, can be very beneficial in this setting. Exercise, asana, and ashwagandha, ginger, and balanced diet per your dosha will help your muscles.
We do have more questions, Olixn. We are kind of at the end of the 90 minutes. Do you want to keep taking questions or?
Yeah, take another question.
Okay. Let's see. Let's take a question from Raman. He's asking, what about depression? How would that manifest?
The question again was depression? What about depression?
He asks, how does it manifest? And maybe I'm assuming the relationship between maybe the dhatus and depression.
Mm-hmm. So depression really is an allopathic diagnosis. It doesn't describe a physiological process. So we have to get a little more clear on what is meant when a person comes and says they're depressed. So often we'll have to ask a little more questions and get a little more information, because depression is often misdiagnosed grief. Not always, but often. So often a person is actually grieving for some loss and they're experiencing depression. It's been misdiagnosed and somebody's put them on a medication that suppresses the entire biochemistry. And now they're really depressed because the fire, the ignition, has gotten turned down, has gotten dimmed. A lot of these medications for depression suppress the synaptic flow in the central nervous system and actually turn the fire and the divine light of the third ventricle in the cave of Brahman, kind of dims it. So there's now a dullness to the awareness and a dullness to the sensorium. And that then the person doesn't feel the pain or the anxiety or the grief or something else that was being misdiagnosed under the umbrella term of depression. So we have to be very, very cautious with this word and this term depression. Generally speaking, it's low ignition, low Agni, especially in the cave of Brahman and especially in the digestive system. Sometimes of the 5 pranas, the uprana has lost its capacity to rise, and the aprana has become overly activated. So the energy of the life force, of the prana, that should be dispersed through the whole organism in all directions, can get impeded. The nature of fire is to rise. So the fire of the digestive system, this Agni in the belly, is naturally rising through uprana. And it should rise up through the Sushumna, through the central canal, into the third ventricle, the cave of Brahman, and create an ignition, an enlightenment, an awakening, an alleviation of depression. If that process is impeded, a person might say they have depression because the rising force is depressed and the illumination that it brings is depressed. And then there's an entire biochemical change in the whole central nervous system. And the neurotransmitters get disrupted and the thought processes become cloudy, unclear, the ojas goes down, the inspiration for life, the vitality of life has now been depressed. So we have to look at ama, toxins, when there's depression, and make sure that we've cleared mental ama, physical ama, and make sure that we're getting the right nutrition to support the fire to rise up as it naturally wants to. It's a big topic again, and again, we have to look for cause, not just settle on a diagnosis that gives a knee-jerk reaction to a treatment, a pill, an herb. We have to look at the whole picture, but those are some of the basic principles we would think about in depression. Maybe we'll take one more question. We're running out of time.
Great, we have one more question, and it's from Lydia. She's asking how to reduce glaucoma.
Glaucoma? Well, there's 2 types of glaucoma. There's closed angle and open angle glaucoma. And a person with glaucoma should work closely with an eye doctor, an ophthalmologist, because they need to keep monitoring the pressures to make sure the pressures don't get too high. An osteopath would treat glaucoma by looking at the flow of the fluids into the eye and out of the eye. So the eye is a microcosm of the whole, and there's this fluid that we were talking about earlier, this plasma, this fluid of this ocean that we're all in, that's inside of us and outside of us. And inside of the eye, inside of the globe, is a vitreous fluid that needs an inlet and an outlet. And sometimes there's an obstruction of the outlet. So too much fluid builds, too much pressure. So we would give specialized hands-on treatment into the nose, the eye, the head, to support the proper flow of these fluids. But we would also be working closely with an ophthalmologist to make sure, or an optometrist to make sure the ocular pressures don't get too high, in which case they may need a medication, because if it gets too high, the pressure, it'll destroy the optic nerve and the sensitive nerves of the eyes. The eyes are closely related to Pitta dosha and the fire. So we would look at the Pitta dosha and the Kapha dosha and make sure they're in balance. There are some herbs that are beneficial, but again, it's going to be a little specific to the individual, not a generic prescription. And a person may consider Triphala eye washes or rosewater eye washes to support the eye health and the reduction of the Pitta. Yeah.
Thank you. And a final question is, we have a request to give sort of an overview of what the spring retreat will be like. If we have time.
A request for what?
To give an overview of the retreat at the Temple of Compassion in April.
Okay, so yeah, that'll be a meditation retreat focused on health, rejuvenation, and immune support. It will entail 3 Kriya Yoga meditations each day. We will have 3 meals prepared tridoshically each day. There will be some lectures and teachings on the health, similar to what we've discussed here, and possibly in more detail. There will be 2 Shirodhara treatments for each participant, and there will be 2 osteopathic treatments for each participant to help rebalance the whole of the organism and take the meditation deeper. Shirodhara really helps deepen the meditation. We talked about the importance earlier, how it balances the fluids inside of the brain, inside of the cerebral spinal fluid. It detoxifies the nervous system and supports the immunity and the ojas in the central nervous system. Osteopathic treatments do the same thing. So the participants will receive 2 of each of those treatments through, I believe it's 5 days we're doing. Yeah, through a 5-day retreat of meditation, yoga, discussion, and treatment for rest, rejuvenation, and deepening of the meditation practice.
Excellent, thank you. And anyone who is interested in that retreat, I just posted in the chat. You can find information on that retreat at our website, pranadawellness.com. The second link is the YouTube channel for Pranada Wellness, which will have a recording of this talk, as well as a recording of the first talk and all future talks by Olixn and other Kriyavans who are participating. The third link is a link to Pranada products. These are the Ayurvedic herbs and supplements that are being produced and sold at the Temple of Compassion. All the proceeds go right back into the ashram there. So please check those out. And thank you for coming. I'll let Olixn close this out.
Do you want to close with a prayer, Rosa?
Yeah, would you mind leading us in that?
You can lead the prayer.
Okay, I will. Okay, so let's chant the Mahamrityunjaya mantra. I'll chant, and please, if you can, follow along on your own. Thank you so much, Olixn Baba. I'm bowing to you and all of the practitioners, all of the healers, all of our gurus and guides. I bow to everyone who's been present at this meeting and those who are facilitating it and making it possible. Thank you so much. Trayambakam yajamahe sugandhim pushtivardhanam urvarukamidavantanam mrityurmokshiyamamritat. Om Shanti Shanti Shanti. Thank you, everyone.
Thank you, everyone.